All right, so here is a 20-year-old Paint Gelding, and he presented with a 6-day history of left-sided epistaxis. This is a sagittal image of the left side and the right side. And so we can see that there's a large soft tissue mass that's extending through the frontal sinus and the surrounding sinuses, and it's intimately associated with those ethmoid turbinates, so up here. This is the same horse. So if you look closely, you can see sort of this swirling hyper intensity in the region of that mass. And I apologize for not having windowed and leveled this more to a soft tissue window. I have that video, I just didn't include it. But it was more prominent with changing the window width and the window level also. Given the location, given these features, the most likely diagnosis was an ethmoid hematoma, and this horse went to surgery. They removed the ethmoid hematoma. It was confirmed through histopathology. Horse did quite well. This is our second to last paper here. So this is JAVMA 2012. So interesting paper. They looked at ethmoid hematomas with CT, and they found that in the majority of these animals, so 10 out of the 16 horses, it had this hyperdense swirling appearance. So this is with a relatively wide window and then narrowing the window. You can see in more of this soft tissue window, that swirling appearance becomes much more evident. This machine, they scouted the horse so you can see where we are on the skull, what level we're at. And they did again compare these images to radiographs. Mass was identified in nearly all of the radiographs, but in 5 patients, the anatomic location of the mass was incorrect. And then all of these horses had paranasal sinus involvement. 2 of these horses, this was not identified prior to the CT. And then in 5 of the horses, the sinuses involved were incompletely identified prior to the CT. So I just think it speaks again to the usefulness of this modality. You know, we can also scope these horses, but again, we're not going to see all of the margins.